Good afternoon. Thank you all for being here. Welcome to Crisis and Opportunity, a conversation about youth mental health in Bexar County. My name is Lee Munsell. I'm the editor-in-chief of the San Antonio Report. We're so grateful to be hosting this timely and important community conversation at Clarity Child Guidance Center, a nonprofit mental health treatment center serving children and teens between the ages of 3 and 17 in South Texas. Thank you, Clarity, for having us. Our panel discussion today was made possible by our generous sponsors. So huge thank you to University Health, the H.E. Butt Foundation, Community First Health Plans, the Children's Hospital of San Antonio Medical Foundation, and San Antonio Preparatory Schools for their support of today's event. And a special thank you to the Sumner's Foundation for their support of our whole slate of 2023 civic engagement programming. Just like the stories our newsroom writes every day, community conversations like this one are a core component of our journalism. This year, we look forward to hosting several hybrid events on important topics in the news, as well as our 8th annual San Antonio Regional PK-12 Education Forum in April, our annual City Fest event, and more. If you value conversations like these on the issues you care about, I'm going to ask you today to consider becoming a member of the San Antonio Report to help make this work possible. Now I have the pleasure of introducing the San Antonio Report's senior reporter covering social issues, who will introduce her exceptional group of panelists to you and kick off today's conversation. Please welcome Iris Timmick.
Hi. Direct all that applause towards our local experts here today. This really would not be happening without any of you today, so I really appreciate you coming here. We're here to talk about youth mental health. It's been in the headlines a lot lately, as I'm sure you all know. A Pew Research Center study released in January shows that 40% of parents with children under 18 are either extremely or very worried that their children might struggle with anxiety or depression at some point. And they're not wrong. According to the CDC, an estimated 1 in 5 kids struggles with a mental disorder in a given year. And so we gather these experts here today to kind of talk through these issues and give some advice really for parents and for the community as a whole as we navigate this post-pandemic world. We're 3 years, we're 3 years into it now, and people can disagree about whether or not it's over or not, but I think the lasting impacts of it are still impacting our children. So let's start with introductions here today. We're going to start, as this is a conversation about the youth, we will start with a youth. Anna Hurd, would you like to introduce yourself?
Hi, I'm Anna Hurd. I'm a representative of District 1 on the San Antonio Youth Commission. Currently, we're working on our second launch of our teen mental health survey. So if you have kids, please encourage them to fill it out. And yeah.
Great, thank you. And Roxanne.
Hi there, my name is Roxana Perez and I work with Communities in School San Antonio. I was sharing with someone, I was a graduate of John Jay High School, and I remember that there was a certain teacher who made the biggest difference in my life and really set the stage for what I am today. I'm currently an LPC, licensed professional counselor, close to 20 years, and 10 years with Communities in Schools. And I'm very excited to be a part of this conversation. Thank you.
Yeah.
Hi, my name is Diana Lujan. I'm with Jewish Family Service. I am the school-based program manager, and the other part of my role is a counselor. I'm an LCSW, and I'm very happy to be here today.
Hi, I'm Dolores Haynes, and I'm the Children's Clinical Director of the Center for Healthcare Services. I'm a licensed marriage and family therapist by training. And children's mental health has always been my passion. So I welcome events like this because I think the more that our community knows, the more we can support our kids through all of this.
I'm Jessica Knudsen. I'm the CEO here at Clarity Child Guidance Center. I'm also a licensed clinical social worker by training. And just to echo, children's mental health, we have a window of time where if we can really impact change in a child's life, it can change the trajectory of their entire life growing up. And so we have a lot of opportunity to jump on that and make significant change for children and their families. And so it's something we're very passionate about here.
Well, thank you all so much for joining us. I'm going to get right into it. The latest CDC report that there's been a lot of media coverage about, and I'm sure y'all have reviewed, it showed the increased levels of sadness and exposure to violence by teen girls and LGBTQ youth. There was wait list across the city and the county for acute care, for therapists. It can take weeks, if not months, to get an appointment. It's pretty clear we're in a crisis. But what are y'all seeing on the ground in terms of trends of common diagnoses, what your friends are talking about perhaps? What are some of the concerns, and how are these teens coping with this post-pandemic world? And that's kind of open to anyone who wants to start. Jessica,
I'm happy to jump into
kick it off. Thanks.
What we've been seeing. And you said teens specifically, but we see kids as young as 3. So these are things we're seeing even in our younger children before they're even getting to adolescence. The analogy I make a lot, which I think helps people wrap their head around it, is if you think about a kid that was in kindergarten at the start of this pandemic, we plucked them out of kindergarten, and then we plopped them into 2nd grade, and then we acted shocked that they weren't acting like 2nd graders. And we're holding them to this expectation that their behavior should have modulated and should fit as a 2nd grader. So I think we're seeing a lot of social anxiety, and you can make that analogy for any transition. A 7th grader going to 9th grade, a 10th grader becoming a senior that graduated. They lost a lot of that socialization. So we're seeing a lot of school refusal. Just kids not wanting to go to school because they're just not used to it, and that's continuing. That's not something that went away the first couple of months when school was back in session. A lot of just peer interaction difficulty and a lot of depression, just overall depression. The other kind of unique thing we've seen a lot of is these are kids that we theorize we wouldn't have seen pre-pandemic. So if you think about your high-achieving kid that did not fit well with kind of teleschool, they're having a really hard time because maybe they're behind academically for the first time in their lives, and that's really devastating if you're a type A kid. And so we're seeing kids even in our inpatient setting that I don't think we would have seen without the impact of this.
I think another thing that we're seeing is we're seeing such an increase in clinical acuity. The levels of anxiety and depression are it really is heartbreaking to see, because so many of these children and adolescents that are struggling with these issues in some cases can't even voice what it is or how serious it is for them. For instance, in 2019, the percentage of crisis admissions was 19% of all of the crisis assessments that were completed. In 2021, that percentage of crisis hospitalizations was 39.8%.
Wow. What do you want to else care to add how you're seeing in the youth that you work with?
Yes, we are, again, communities in schools, so we do have teams of counselors, LPCs, LPC associates, and social workers in the field, in and out of the campuses. And I did ask them, I picked their brain to know if my thoughts were in congruency to what they were thinking, and yes, we do have very similar feelings of depression, feelings of anxiety. Grief is a large referral source. We have behavior issues because of the littles sometimes having a challenging time regulating their behaviors, peer-to-peer relationships. A lot of students are also family dynamics with separations and divorce of parents is another big one that referral sources that we're seeing at this time. Emotional regulation is a big one as well.
I know in the school I see when we first did our teen mental health survey, the first launch we did, the results showed that the majority of the people that filled it out and completed it were females between the ages of 13 and 18. So that definitely backs up what the CDC is saying. I think also there's just kind of like, in schools, there's definitely a lack of motivation to do schoolwork. So I know, like, I have friends who talk about how many assignments they're missing and kind of just laugh about it, but it's like, there's a lot of people who just have very little motivation to get their work done.
Yeah, I mean, as the pandemic has disrupted, like you said, personal relationships, school relationships with teachers, and it's certainly, you know, even professionally, I think a lot of folks had a disruption in their workflow and things like that. So what can we do? I think, you know, identifying mental health issues in children is so important, but like, what does that look like, especially in teenagers? Because we know teenagers, that can be a little, you know, irritable, like, and you know, rebellious and things like that. But how can a parent or a community member identify an issue that's beyond like the normal, quote unquote, normal behavior of adolescence? It's open for anyone. I know that's a big question, but that's kind of what I want to get at, and what I think a lot of the community kind of needs to hear is like, what should we be looking for?
Well, I think one of the things that as a community we certainly need to understand is that children and adolescents manifest their symptoms of mental health differently than adults do. And one, you know, you talked about that they're rebellious and they're a little bit angry and cranky, and part of that is developmental, because as a teenager, it is your job to start figuring out, who am I in this world? Who do I want to be? You know, starting to really build your own identity separate from your family, so that breaking away from family is absolutely normal. But as if you see a child that's isolating from family, and they're also isolating from friends, and they're also losing interest in things that have always brought them happiness and joy, you're looking at something that is beyond what they normally do. And I think that it is imperative that a trusted adult, whether that is a parent, a teacher, a counselor, whoever that person is, at that point, I think it is imperative to have a conversation with that young person and let them know, listen, I'm concerned for you. These are the things that I am accustomed to seeing from you, and these are the things that I'm seeing right now. Help me understand what's different, and give them the floor. You may be shocked at some of the things that you hear, but for a young person to know that there is an adult out there that is taking time out of their own schedule, their own job, they're taking time sometimes from their own family to focus in on, I'm concerned about you, that means a lot. And every one of you in this room right now may be an adult that is trusted by a young person and you don't even know it.
You don't have to be a counselor to yeah. A little empathy goes a long way, and just listening to what somebody might be going through. And I think too, also, our ability as a community to support the work of folks like Community Schools, what they're doing is really, really important, because the same folks, the adults that are supporting these children, are the parents, the teachers, the bus drivers, all of those, that group of people that are helping. We need to help them too, so they can be supportive and be there for them.
Same. I mean, it's so fascinating just having discussions with different clinicians, and very same. The isolation is a big one. Drastic changes, drastic hygiene changes, drastic friend changes. Those are all things that we have noticed. a lot of times when the clinicians come out and speak with the students, they'll say, well, I was waiting for you all week to share this with you. And the students will ask, well, why didn't you share this with X, Y, and Z or whatever? Oh, you know, they'll get mad or whatever, or they won't understand. And it's a little sad because I wonder if just that little opportunity to say, hey, I've noticed something. Do you want to chat about it for a little bit? And then maybe that would open the door.
Yeah, just
Can I add to that? Because I think for parents specifically, how do you know if it's just normal teenage angst versus something more serious? And I think parents, the population in general, we get afraid to ask certain questions. There's a misperception that if we ask about something, it's going to implant an idea in somebody's head. If I ask if you've ever thought about harming yourself, if I ask if your friends are talking about self-harm, if I ask about substance abuse, then you're going to go out this weekend and you're going to think about suicide and start drinking. That doesn't happen. That's a fallacy. And you might be surprised when you ask, to your point, to have the conversation, but ask those questions too. You might be surprised that, well, I haven't, but my friend, and they might, if they know it's not a taboo topic and that you have a safe place to talk about those, even though they're uncomfortable topics, you might be really surprised as to what you hear. So don't be afraid to ask the questions that you probably don't want the answer to, but it's so important to have that dialogue.
Well, and I am not personally a parent, but I know lots of parents. I feel like it can be hard to have perspective, the same kind of perspective that, say, a teacher would have. So what kind of role could friends or teachers have in talking to parents about these issues? Do you all encounter that a lot, especially at communities and schools?
I guess, would you ask again?
Sure. Do you get parents coming to you or to communities and schools staff asking about mental health issues within the school or within their child?
Yes, I think especially our site coordinators, they build relationships on the campus and they provide case management to the student and to the family that's there as well. So I love it because we'll have like guardians and or grandparents or aunts and uncles or relatives or parents that will say they're acting this way, like I don't know what's going on based on that relationship, and say, well, how do I talk with them? How do I bring this up? But a lot of times it's interesting, the students will be the ones who will say, like kind of nudge us, like, can you maybe ask my parent or tell my parent about this, because that would be important to me, and how to navigate that. And so sometimes they want us to be a part of those conversations.
Yeah. Well, and maybe Anna, you can speak to this the best, like, what kind of works when a trusted adult approaches you and asks questions? Like, what do you think works best, like for your friend group, or to really get that conversation going? Like, do you have these conversations with your friends?
I think like the most important thing for teenagers to know is that like their parents are there for them. I know when I was in my younger teenage years, I definitely thought that my parents were against me, and the only phrase I used when they asked me how I was doing was, I don't know. So I think it's definitely important to grasp that, I mean, I'm fine, I don't know, it was good. All of those words are words that teenagers use a lot because they don't feel like they can say what they feel. So I think just like being able to make a space that's safe and where a teenager can feel like they have a trusted adult or a trusted person they can talk to is one of the most important things you can offer them. Because I know it definitely takes participation on the teenager's part to get better, but I think you can give them the opportunity, and if whatever they want to do with it, they can. So
I can attest to that, because I think a lot of the work that we do, the most important work, is working with the families, working with the parents, so that they can coach, they can support, they can be there for their child, because we see them once every week for 50 minutes. The rest of the time, they're with their parents or their family members, so providing them with support on how to handle these issues is a lot of the work that we do.
Well, it sounds like we've kind of identified awareness as one of the big issues that parents and teachers and even someone like me who doesn't directly work with youth, just being aware to create that space. I think capacity is also an issue. But what in your line of work or system-wide or within your agency is the number one gap or barrier that you see in this system that's kind of getting in the way of youth accessing and getting this help? Now, it's a big question as well, but
I think workforce development. It's if you look at the statistics, and HHSC just did a big suicide assessment for the state, and they dug into a lot of different areas. There's only one county in the state of Texas that is not a mental health deficit county. It's Wilkes, I think, outside of Austin, but that's it. Every other county in this state does not have enough mental health providers. If you are prone to legislative calls of action, there are some bills that are out there right now that we're hoping will help with the workforce component of it. There's increased funding for pay down of student debt for folks that are going into the mental health field, which is a bill we're personally trying to advocate for, and because I think that makes a huge difference. And then there's some billing legislation out there that would allow provisionally licensed therapists to be able to bill Medicaid, which would open up, that would almost be an instant pipeline that would get some more appointments out there and help with access. So if you know your senator or have an ability to help push that through, those are two bills we think would really make an impact from the workforce perspective.
I think technology is one of the big barriers between adults and teenagers because, I mean, teenagers, we use our phones for everything. We text, we FaceTime, we look at social media. I think it's one of the biggest ways that teenagers cope is they anesthetize with their cell phones. They scroll through TikTok, they like people's Instagram posts. I mean, it's one of the biggest barriers because teenagers don't want to find other methods when they found one that kind of numbs what they're going through for just a little while. So I think that's definitely one of the big issues is technology.
One of the gaps we're noticing, or one of the reasons just the clinical team is now moved into the schools, which has definitely opened some doors. I think one of the reasons that we're hearing from parents and families is transportation after working several jobs, being exhausted, having other littles in the home that you have to take care of, and then maneuvering a student that has needs for mental health and trying to get them there and cook the dinner. Who's going to take care of the little and what kind of arrangements do I make, and then getting there. The other thing that we've heard is just it seems confusing and overwhelming the processes of, I know even for us, like enrollment packets, documentation of legal guardianship, who's the legal guardian? That's a really one that we're kind of trying to help support in, and sometimes they don't even know what questions to ask when they're on hold for hours trying to get help from somebody or what questions to ask. So those are things that we've noticed as far as like gaps in mental health.
I mean, absolutely what these ladies have already, what they've already said. The transportation piece, the fact that traditional hours for mental health clinics are traditional business hours, and it doesn't work for a lot of our families. They cannot.
Yeah, I mean, especially as we have a large population that has more than one job, more than one child. I can imagine how hard it would be to schedule something in the middle of the day or right after work to see someone. The community, the state and federal and local governments, are we spending money on things that don't work? Is there something that you would rather see the community invest in more of? I mean, we mentioned those gaps, that's an obvious one, but is there something that's not maybe clicking at the federal, state, or local level? That's a big question. What would you rather have funded?
School programs like CIS does. I mean, that's
we have the potential to reach more families and children at schools. It makes sense. So programming like theirs, and everything everyone else.
Yeah.
Right? Make sure that there's enough childcare. You know, the cost of living is increasing, so affordable counseling or no-cost counseling, all of that makes a huge impact.
It sounds a little bit like kind of the wraparound services that a lot of like the workforce development program has to support like the whole person.
It really makes me, it's a little sad, but a little hopeful, where a majority of our families and referrals said they would not be able to access services if it were not that we're providing this in the school. And we're so appreciative of our relationships with the districts across San Antonio, because if they did not open that door for us to be able to reach these students, just as many students as we're seeing, where would they get that help if this was not an offering that's available?
Right. I think it's such a big question, which is why I had to ponder it a little bit.
Yeah, take your time.
It's because where do you put the funding? Right, you know, we're in crisis right now, so we need more inpatient beds because we have kids that need that right now. But I think everyone knows the story of upstream. You know, we keep taking debris out of the river downstream, but we don't take the time to walk upstream and say who's throwing it in. You know, long term, it makes more sense to put that money in the upstream services and in the schools where the kids are. There's some challenges with that. Having 17 school districts with 17 different leadership styles creates some challenges with that, with getting effective services in there across the community. But it's tough because I think you have to spend on both, because this takes a while. We have to put that funding in the upstream, but that's going to yield results in 5, 10, 15 years, and we can't ignore what's happening right now. So you need a big pot of money for both, unfortunately.
And I think that as a community, we, as well as a nation, really, if there was more investment, you know, under the umbrella of children's mental health, there was more investment in targeting the mental and emotional health of the family. Because often, you know, people forget that when we're talking about children's and adolescent mental health, every one of those kids is in a family of some sort. And those parents may be feeling the exact same stresses. You know, more and more of our teenagers are worried about family finances because they've seen their parents lose jobs and get laid off during the pandemic. And to be able to target the child and the family, to do the education for the family on the diagnosis of the child, to make it okay for the parents, the guardians, the grandparents, the caregivers to be vulnerable about what their own needs are. Because as we all know, you cannot take care of someone else if you haven't already taken care of yourself. And there are parents out there that feel like they don't have time to take care of themselves because they see their children and adolescents in crisis, and that's where their focus is.
Well, that kind of slides well into the next question about what the greatest opportunity is in this moment, and kind of the silver lining of this crisis. Like, what are we poised to be able to do? Is it to provide that kind of whole family care, or maybe it's just more awareness because of the pandemic? That's okay.
I think the biggest opportunity is with technology right now. I think similar to the conversation you and I had, and what you were saying, Anna, about you all going on, you know, social media, or you're technology driven. I think we have an opportunity there to reach more folks, more youth, that can maybe ask their parents to help them access these resources. I'm sure it's not a fix-it-all approach, but there's so much social media out there that if we can get our hands on it, as individual agencies, talk more about it openly, maybe we can reach more folks.
I mean, the internet's a great thing. There's just so many resources online that people don't know they can access. I mean, there's so many. Like, there's crisis hotlines, there's online resources that direct you to different websites with information. So I think when used properly, the internet has a large slew of resources that can really help people, but they have to know about it.
I agree. It's sort of I don't know. I have ambivalent feelings about but I can understand, because it's true. I've had heartbreaking stories where students have connected with someone, obviously online, and they were getting these thoughts and support. But then when I hear the thoughts and support, I'm like, what is going on right now? So it's right, finding the appropriate connectors, and I really feel like it can. I do appreciate it because in talking with my team, I was mentioning how I would go down the hallway. We try to keep it very low key when we're seeing students for services, not like I'm the therapist coming in here to see the student, so I'm kind of like, I'm with them, seeds or whatever the program is, just try to keep it low key. And the student down the hall, that's my therapist. Roxanna's coming here to see me, and I'm like, oh my God, like, are they sure they're comfortable with that?
Right.
But I feel and also it's a sense of, okay, then the conversation is, well, I want to see somebody too. I think I'll need somebody, miss, they were telling me, or whatever. But on the other part too is right, finding the right connectors, because the fear is who's speaking to the students and what those conversations are, and are there bringing positive things, instead of things that were a little bit on the alert for.
And I think just this, I've been, won't share how longer than I care to remember, but we've had more conversations about mental health in the last 2 years than I have the previous years of my career. It's this generation and Anna's generation, it's much more normalized than it's ever been. When I was in high school, you would never have talked about someone getting treatment for depression or anxiety. So I think normalizing it is the first step. We need these to be casserole situations. And by that I mean, if you have a child that goes to the hospital for appendicitis, they make a meal train for you, and they show up and the community wraps their arms around you. We don't do that for mental health. I can guarantee you none of the kids in our inpatient hospital have a meal train set up for their family. We have to get it to that point, and I think that's a real opportunity to continue these conversations and make it as normal as getting ear tubes put in, or any other treatment that our child is going through.
Well, and we've kind of touched on something that I think millennials and Gen Xers, they don't have the same stigma attached to mental health. However, they are being raised, by a generation that likely does have some sort of stigma. And I think Jessica, you and I talked about this a little bit, but there's still a little bit of that for the parents that have to acknowledge, first that their child has an issue. And I wonder if y'all encounter that very often. What does it look like, and how can we reach over that and tear it down?
Well, a lot of the things that, in my experience, that I've heard parents say is, if I'm saying that my child has depression or anxiety or suicidality, then am I also saying I'm responsible for that because they are my child and with them? So talking about that, helping them understand that the idea is not to blame anybody, to figure out a solution or help and support in any way that we can.
Exact same. Right. We deal with a lot of parents that personalize it. And if you make the analogy of diabetes, a parent presenting in the emergency room in a diabetic crisis would not, and they may somewhat, but they're not going to internalize it as this is my fault that my child was born with diabetes. It's getting into that same mindset for mental health disorders, that it's something that their child is going through, not something that they did to them.
We experience that quite a bit in conversations with the families. Just that fear. I don't want to label somebody. What if they themselves are struggling with mental health issues, and what's worked for them. One of the clinicians told me, okay, so their coping skills and their ability to handle, like distress tolerance levels for an adult is definitely a lot different than when you're talking to a student who maybe hasn't experienced, their first time having a heartbreak versus an adult who's maybe gone through, childbirth or family tragedies or whatever the case may be. So I feel that it's still there, but I feel like, again, as a community, I do appreciate the opportunity to have. Just yesterday, I was having a conversation with a guardian who was just really feeling overwhelmed by the system and by the attempts to help, and how she was just not there yet, and letting her know that it is okay. I'm here, that we can continue. These are different options. We can continue to have this discussion. I'm not going to pressure you into therapy or doing something against your will, but it's just being open to those conversations and not feeling like, you're not a good parent, or this means it's a reflection of you. But sometimes too, you have to open up those doors, and maybe sometimes parents may not be there yet.
I think one important thing that we as practitioners of mental health can do is to let our families teach us about themselves. Because all we get in that, in that first meeting is, this is what one person or many people have put down about you on paper. Who are you outside of this? Tell me about your family. Who is the voice of the family? Give me your family structure. Let's talk about who you are. And this is part of it. This isn't the end all be all. This is someone's opinion. Do you think any of this is correct? So let your families teach you about who they are, and for parents to help them understand that, one, it is not their fault, and it's not about blame, but to help parents and guardians understand how important they are in the prognosis and the success of their child's mental health journey.
Well, and Anna, do you? I know you can't speak for the entire generation, which is okay. But do you feel comfortable talking to your friends about their mental health issues? Have you ever had those conversations?
I think it really depends. A lot of people are ashamed that they struggle with mental health. I know that for a period of time I was ashamed that I wasn't perfect, and that I wasn't I wasn't doing everything right. So I think that there's a lot of shame in our generations, and people think that it's their fault and that they can't do anything about it. So they kind of just go into a downward spiral and just say, like, I can't fix myself. There's nothing anyone can do. I'm broken.
Right.
So I think it's difficult to talk about it, but if you can talk about it, it's really valuable too, because what I've learned is that a lot of people have had the same experiences that I have, and it makes me and it makes other people feel less alone, knowing that other people have struggled with the same things they've struggled with.
And you've mentioned that you see the peer support model is really important. Tell us a little bit about what that looks like.
So currently the Youth Commission is working on implementing peer first aid training. It's definitely a work in progress, because our main focus right now is the survey and our youth summit coming up. So I think that's definitely what we're wanting to put funding towards. And ideally it would help teenagers to be able to talk to someone that's not an adult, because sometimes talking to an adult about what you're struggling with for mental health can be really overwhelming. So just being able to enlist the support of a peer could be less overwhelming for some students, and it could really encourage students to reach out for help.
Yeah. We got a couple more minutes. And I think we've already kind of covered a lot of these topics today, but since there aren't enough providers in Texas, as we mentioned, obviously schools are a central point, and peer support groups are a central point. What are some other opportunities? Is there something that the broader general community can do? What are some alternatives to traditional therapy that y'all have come across? I'll give you a second to think about that at all.
I
think pediatricians play a huge part
Okay.
in this overall management, because that's where you go first.
Right.
Especially if you're not sure what to do with your child. So I think making sure we're having those dialogues with pediatricians' offices, and they know what to screen for. And if you've been to a pediatrician recently, they do. They ask about behavioral health, and hopefully can either, sometimes they'll even start medication if it's something that's not that complicated. So I think that's a resource we need to make sure that we're developing fully.
I like the idea of just overall health. One of the big things that we talk about often when we see students is the way their eating patterns are. It's kind of alarming. So they don't eat anything all day, and then they have hot chips, I guess, just to make it last. And then at home we'll eat whatever, you know, is there. Sometimes parents are working. So they just kind of fend for themselves a bowl of cereal. And I remember having a discussion with the students like, protein, you know, let's talk about protein, and then pick at it, please, you know, just trying to encourage that. But I think some of the basics, just as a community, encouraging them, like proper sleep habits, you know, proper sleep etiquette. Like the sun is important. Actually going outside, please, you know, for a little bit is good for you. It really is. Going for a walk, walking your dog, playing with friends outside, just some of those things, I think, they're not therapeutic per se, but I feel like, but the sad part is sometimes parents aren't doing that either. Families aren't doing that to take care of themselves. I know I personally struggle sometimes with those things as well. But I know how better I feel, and I know how many others who have tried to take care of those things. And I think those are important pieces of conversation as well. You know, to feel better, these things will make a difference, because you already have a lot on your plate, so let's not add not eating or not sleeping or not going for any kind of activity outside or anything. I know it sounds basic, but I think it's important.
Colleges, schools, and I think faith-based institutions also, getting them into these conversations, inviting them into these conversations, because they are probably the first responders and then referred over to us. So
And there is a big initiative, on the name of the initiative, I apologize, but it's through NAMI, the National Alliance of Mental Illness, that they're doing a similar first aid mental health training with the churches and clergy members to help provide some of that intervention.
I know my mom definitely preaches this, but making your bed every morning, she's on it. She's on me about it every single morning, and for the longest time I was like, that's not going to do anything. I'm pulling up my sheets, I'm pushing them into a mattress, it's not going to fix everything. But I mean, it really does help, because starting off your day doing something and like finishing something really does, it makes a lot of difference.
I walk my dog for mental health personally, so there's lots of little things we forget about. Well, cool. Well, I think we have some time for some Q&A. I don't know if we're collecting them online as well, but I would like to open it up to the audience here. If anyone has any questions for our panel or any observations even. It doesn't have to be a question. Sure. Sorry, Jen. Go ahead. Sorry, I forgot to project.
So my question is this: as teachers and in our case faculty in the university, one of the things we traditionally have felt is our job is to help develop a sense of responsibility, work ethic, all these things, right, in our students, and holding them accountable and all this stuff. And right now, when students often seem to be presenting in crisis, it feels like a wrong time to be saying, you know, you're one day late, but this is the deadline. You have to be more flexible. And I'm kind of wondering though, where's the balance? We don't want to be enabling and not prepare for their next steps. And yet we want to be flexible and supportive and give them that space and care that they need.
Well, so just for our online audience who may not have heard, it sounds like you're asking about kind of how to approach the accountability side of like taking the next step after a crisis has occurred. I don't know if y'all.
Well, in the balance, right?
And the balance
for work, and at the same time being supportive.
Right.
I think the question is the answer. Because it's like anything in life. In our relationships that we carry, it's about balance and boundaries. And balance of the two, a balance of between boundaries and compassion, right? How can I be compassionate, but at the same time hold them accountable for what they need to do or the rules that they need to abide by. So somewhere in the middle is where we enter.
I agree. I think that you answered your own question. It is about that balance, because as a teacher, as an educator, as a parent, as an adult, there are specific expectations that we have to set forward. And if you're teaching a class, those are your expectations. And in addition, I think to kind of balance on the other side is, let your students know how they can contact you. What are your office hours? Are there any resources that they may be able to tap into, either as a part of the boundary of the course, or if they're struggling with something that's going on in class? And kind of building that level of respect and trust in the classroom, and giving students the opportunity to seek you out if they need to. I think if you can establish that as part of the boundary from the beginning, it may be easier for that student who may be struggling with something outside of class that's affecting their ability to get things done in class, easier to talk to you about if that's just part of the organicity, the organic nature of your course.
And I was just going to add, it's not a one-size-fits-all. It's hard to write a policy for this, that this is what we're going to do in this situation, because it really does depend on the individual and where they're presenting. And going back to your point about it's health, it's wellness. What would we do with a student that had a physical ailment, and what accommodations would we make in that set of circumstances? And it's probably going to be different depending on how they're presenting and what their needs are. So I think it's just being open and flexible to create a plan that works for that student.
I think most of the time what I've experienced is that if I ask for an extension on a deadline, I think like 90% of the time it's given. So if students ask for that extension, or if it's the other way around and the teacher offers that extension, or somebody offers an extension on a deadline, it's taken well from students, because when you're struggling with a crisis, hard deadlines aren't exactly your first priority. It's kind of just like you're flowing through it all, and you're gonna get it done when you get it done.
And I think also their ability to just hear from you, or whoever the faculty, teacher, whoever it is, like, I hear what you're telling me. Like in my opinion, also, like, I like the whole story of making the bed. So what is it a step that you do feel comfortable in moving towards your goal? If your goal is to complete this class, or your goal is to achieve this, what are some steps that you feel comfortable, you think you can do? We can check in on it next time. And it could be that maybe, half of a part of one, but they made the bed that morning, or whatever it is, they had breakfast. I don't know, but that's working towards, the ultimate goal of achieving this, and they feel like, oh, progress was made. I feel like if you start getting to the habit of achievements and progress, you can kind of get more in the swing of it just a little bit.
Oh, got a couple, yeah.
When you guys are offering resources to the children, say they need counseling, do you find yourself offering a particular resource? A lot of what I see is automatically they just offer Center for Health Services, and then it kind of stops there, and then there's no follow-up to that. And so I'm just wondering how we can close the gap on that, to say, hey, if you schedule an appointment or walk them through that, because it is a scary process for family, and they don't know. And then additionally, you guys, I see a lot of providers and organizations moving to trauma-informed care and person-centered practices, which I think is very, very helpful, because we establish what is important to and for them. A lot of times we make the assumption as providers, or the adult, in saying this is what's good for you, and that may not necessarily be the case. So I really resonated with what you said, that we should learn from the families.
Right.
well, and for our online audience, there's a question about what are your go-to resources, beyond your own agency, of course. Where do you point parents and community members looking for help and children and kids?
Well, to respond to that question, I think that we, as providers, in some ways we do a disservice to families if we're just giving them here, call this number and everything's done. If we can take the time to sit with that family, call the number, get the first appointment scheduled, okay, this is where they are in town. If you happen to be on the bus, this is the bus line that'll get you there. Really do that legwork up front, regardless of whether you're referring to an agency or you're referring to a private practitioner. If you're taking the time to set that family up, that initial work may be the first success that they have. And if they can build on that by getting to that first appointment, wherever the appointment is, then they've started to establish a pattern. And that's one of the things that I think as practitioners, as mental health practitioners, we are sometimes, for the families that we work with, we are their first piece of order in what's been a pretty chaotic season for them. And if we can be consistent and take that time, slow our process down to help them understand that, yes, the mental health system, wherever it is that you enter it, is big and it's overwhelming, and these are some of the things that you can expect. These are some of the places that you can go to get that service. Why don't we take that time to discuss what it is that you really want, and then let's make some calls and try and get you connected right here, right now, so that you walk out with something saying, okay, I'm gonna get started on my way.
But I think there are also significant healthcare disparities in our community, and your families that have private insurance or can self-pay out of pocket have a ton more options than a child that's uninsured or on Medicaid. So our list of providers for kids in that set of circumstances is about that big. There's just not a lot of options out there for them. So it's helping them navigate that, but it's a lot of providers don't take Medicaid, and that's just the unfortunate reality out there. And so it makes it, we treat about 65% Medicaid our inpatient unit, so it's a daily challenge of trying to sit down with them and make that first appointment. Sounds like, sure.
What role does the faith community play in this conversation?
That's a good question. The question was about the role that the faith community plays in this conversation, and
I remembered the name.
Yep.
Yeah. Bridges to Care.
Bridges to Care. Yes, I was racking my brains.
Yes. As soon as I stopped talking, it popped in my head.
Mm-hmm.
So I think it's huge, and they've made a lot of inroads with community churches and different organizations to get those clergy trained. So I think it's a huge component.
Yeah, I attended an event a few weeks ago about domestic violence in particular, and that program also kind of feeds into that work as well, to be able to train faith leaders to recognize the signs and point their congregation towards some of these resources.
I'm excited about it. I feel like recently I've seen conversations from ministers, different people speaking clearly from the pulpit about mental health, and even to the point of medication. And I really appreciate that, because that is another sort of, it can be for some a very scary place to tread, meaning that maybe when we were talking about like shaming parents, maybe we don't want to shame God to say that that's not sufficient for us. But I think we're a community and we were built for each other, and I like that concept of those messages being from the pulpit about the importance of mental health, and of not dissuading people. If you need a counselor, a therapist, or a psychologist, psychiatrist, like they will encourage that and support that. So I like those conversations. I'm starting to notice them a little bit more recently.
Well, I saw a hand. Yeah.
So how are you guys all holding yourselves accountable to reaching out to underrepresented demographics that we know need the help the most, but aren't able to get, all of these plethora of resources that y'all are saying are out there.
The question is about holding ourselves accountable, about making sure that underrepresented, underserved communities have access to these resources.
I think when we're looking at the teen mental health survey, we have questions about demographics and what districts people are living in, so we can assess the needs of certain districts and people who are underrepresented and go from there. I know it's definitely an issue to get resources to people who are underserved, who live in the poorer districts of San Antonio, so it's definitely a problem that I know a lot of people are working to fix, but I think we, as the youth commission, are taking a step by trying to figure out what kind of people, where people are coming from, and what kind of resources they need the most.
I know for communities and schools, those are the students we pursue. I feel like we really pursue those students based on our relationships. So it can be that, let's sort of say, the cafeteria staff noticed something, or someone that was alone or crying, or no one noticed, or a custodial staff, or a lot of times the clerks of the school will say, hey, so-and-so, or this person, they're alone, or they need that extra, or our teachers, faculty, and staff, they'll notice things and bring it to our attention. So I really appreciate having that. Again, I'm so appreciative to be able to be in an environment where we can pursue families if they're open to us.
I agree. Our agency, that is the population that we work with. Efforts and partnerships with CIS help us do that. Our partnerships with folks in Uvalde, and then we just recently began working towards trauma-informed care certification with ecumenical centers. So I think that's going to help us too.
And for our organization, our children's population is probably 85 to 90% Medicaid funded. And for those families that don't have funding but need services, we can help them too, and help them get Medicaid or CHIP or some funding to pay for not only our services but other necessary services that they have. So I mean that's the population that we serve on a daily basis.
And similar, we were able to provide services regardless of a child or family's ability to pay. That's part of the beauty of being a nonprofit, is we don't have to worry about that component of it.
We do one more question? I promise. Okay, one more question.
So, as university professors, we're preparing future teachers. And one of the classes I teach, students are often asking, and these are students are 19, 20 years old, and so they've just come from high school, they've been through COVID, they themselves have experienced some kind of mental health issues. And one of the biggest concerns and questions that they often have is, I don't remember seeing this kind of care in my schools. As a teacher, as a future teacher, how do I know where I'm supposed to go? What am I supposed to do? And as professors, we usually point them to wherever the counselors are on the campuses. And from their experiences, we're hearing, well, the counselors just, kind of gave us a pamphlet or a phone number. So what can we tell our future teachers in how they can support their students in need of mental health care?
It's a big question.
That is, how do I say, even sometimes within the schools, for example, our program is a SEEDS program. So we have a social worker working with a clinician, LPC or LPC associate, to go provide services to the students. But one of the things I appreciate, depending again on who's administrating, who's overseeing, we were given, I guess, the opportunity to roll out with all the school counselors of the district, and it's a large district. I don't know how many meetings we had on Zoom just explaining what we do and clarifying and offering that we're there. But I think it is, if you are going to be in a place of serving others, to inform yourself as far as ask the questions of what's out there. The school counselor may or may not know they have like family liaisons between the districts, someone that advocates for them. Certain districts have social workers that have a lot of access to support. There even, I know there's been bilingual teachers that I connected with, and they knew all the families and all the resources available on the school, so they were like the go-to people. So just finding out who is that go-to, who has the heartbeat of the school, that particular campus, that you can just pick their brain, because those are my favorite people to seek out on a new campus. Because they'll tell you, this is a strong parent who has influence, these are the resources available, this is not working, no one goes there, whatever the case may be, like they'll give you the lowdown. But I feel that it is important to ask who supports the families, who supports the students, what works, what is the history with them, and they'll be able, those people, every campus pretty much knows who those people are, and it may not necessarily be the assigned person.
So is it my understanding that there is not something systemic in place across all districts in the state of Texas?
No.
In how mental health care is served?
Oh, no.
So it's completely different.
It's different in each of our 17 school districts, just in San Antonio.
And so is that something that we're trying to figure out a way to put a more systemic process in place?
I think it's definitely difficult because there's 17 different districts, and each of those districts has a different leadership staff, so having to bypass kind of all of that like administrative stuff is an absolute nightmare. I mean, the youth commission has tried doing it to get like flyers put up, and it takes a while to do even that, so it's probably unimaginable to think about how much time it would take to get a kind of like a mental health standard put in place between all these districts.
And politically, there is some pushback on that. You would think this would be something everyone would rally behind and support, but there are some pockets at the state level that don't want us talking about mental health in the school. And there's some very interesting conversations at the legislature level about that right now.
Especially when it comes to LGBTQ.
Yes.
All right, well, we are right out of time, but before we pack up, I'd like to bring Lee back up to the podium here, and thank you all so much for joining me. I really appreciate it.
Thank you, Iris, and thank you, panelists, for that honest and thoughtful discussion of such an important issue. We're almost out of here, but before you go, briefly, I wanted to explain a little bit more about this event today and who we are at the San Antonio Report. Our newsroom and team is made up of hardworking professionals who are also members of this community. The work that we do and the events that we host arise from the news cycle, but they also arise from our own experiences. The issue of youth mental health is very personal for our newsroom. I know it is also very personal for many of you. In fact, there's no one in our community that isn't affected by the issues that Iris and our panelists just talked about. But I wanted you to know that because I want you to know who we are. We are journalists, but we're also parents and neighbors and friends. We do this work because we care deeply about this community, and we care deeply about the stories that we cover. Sometimes when we do events like this for a community engagement, we ask you guys in the room and watching online to become members. But today I wanted you to hear exactly what we're asking, which is to join us in this work. Go to our membership table in the back of the room, meet Hannah Rhodes, meet Samir Ahmadi, give them your business cards, tell them your stories, send Iris an email about today's event with your feedback. The San Antonio Report is going to keep covering youth mental health, but we can only do that well when members of this community join in the work we're doing. So we ask you to consider becoming a member today. If you're not ready to become a member, sign up for our newsletters. The sign up button is on the right side of our homepage. Our commitment to you is that this conversation is not over. There's a lot more to say, but we need your voices and your stories to be part of it. Thank you again for being here. Thank you to our sponsors, and thank you to our members for making the San Antonio Report's essential community service journalism possible. If you're not a member yet, sign up. We need you. Thank you all for listening. Have a good day.